Hello and welcome to Edupedia World. In this session we're looking at health. Words and phrases to use if you get sick or have an accident, or if somebody else gets sick or has an accident. We will start by describing a problem. The words I have, or he has, or she has can be used. I have a cold. She has a temperature. This means she has a high temperature. I have asthma. He has dementia. If you feel pain, you can use the word hurts. My back hurts. My foot hurts. My stomach hurts. A pain that is not very bad, but doesn't go away, is sometimes called an ache. I have a headache. I have a stomach ache. I have a toothache. I have a backache. You can also use I feel. I feel tired. I feel sick. I feel old and worn out. I feel like I'm getting the flu. The flu is a nickname for influenza. It is short for influenza. If you have an accident, you will need to explain in past tense terms, such as I fell down the stairs. He hit his head. He burned his finger. I crushed my foot. If you think you have broken a bone, you say, for example, a bone in your arm, you would say, I broke my arm. Or for a bone in your leg, you would say, I broke my leg. Even though there are many bones in your hand, if you broke a bone in your hand, you would say, I broke my hand. Or, more likely, I think I broke my hand. You can also say, he broke his hand, she broke her hand. That's a lot of broken hands. The phrase I can't can be useful. I can't move my arm. I can't lift it higher than my shoulder. I can't get to sleep. I can't feel my fingers. Oh, by the way, in English we say broke my hand or his hand, not broke the hand. To get someone's attention, you might say, excuse me. Excuse me, is there a hospital near here? Excuse me, is there a doctor around? Excuse me, could I make an appointment, please? Excuse me, could you put some pressure on my brachial artery, please? And then you might use is there for is there a doctor here? Is there a hospital here? Is there a medical center nearby? Is there a pharmacy here? A pharmacy, also known as a chemist, is where you can buy medicines. The W questions can be used here. What, which, who, and when. Who doesn't sound like a W question, but it starts with a W. Also, how. For example, what's this medicine for? Which means, what is this medicine for? Or, what's your doctor's name? What do I tell them at the hospital? What's the number? If you have to choose between several things, or even two things, you use which. Which way is the quickest? Which pharmacy is the best? Which street is the pharmacy in? Which doctor do I see? For questions of numbers and quantities, we use how. How often do I take this medicine? Meaning how many times a day. How long will we have to wait? How soon will we be there? How quickly can we be seen? How many tablets do I take? How is also used to ask the method. How do I get in? How do I make an appointment? We say, how do I, or how does he, or how does she? How does she feel? How does she know what happened? How does he find his way? We use who when asking about people. Who is my doctor? Who do I see about this? Who do I ask for? We use when. When can I go? When can I see her? When can he come home? When can is for things you want to happen. When will is for things that will happen. When will the operation be? When will they see us? When will he wake up? When does the doctor come around? Or when do the doctors come around? When do I take the pills? We say what time. What time is my appointment? What time do the doctors come around? What time is it? In this situation, we are not making conversation, but getting information. So a short answer can be preferred. Questions that get a short answer often start with is. Is the hospital far? Is the doctor in? Is it hurting? To ask someone what to do, you can use should I. For example, should I stay home? Should I go to the doctor? You can use could you tell me to introduce your question. Could you tell me where the doctor is? Could you tell me how long this will take? Could you tell me where it hurts? Or, I'd like to know. I'd like to know what you recommend. I'd like to know how much that will cost. I'd like to know if I should wait. When asking for advice, you can use what's the best way? What's the best way to stop this from happening again? What's the best way to treat one of these? What's the best way to get him into the car? You can also say, what would you recommend? What would you recommend for a headache? What would you recommend for arthritis? Or if you have two options or more, you can simply say, what would you recommend? For example, I have Nurofen and Panadol. What would you recommend? You can ask someone's advice by saying, do you recommend? Do you recommend that I take painkillers for this? Do you recommend rest? Or do you recommend that I should rest it? When talking about possibilities, you can say, what should I do if? What should I do if it happens again? What should I do if the pain increases? What should I do if the bleeding gets worse? For general advice, you can say, give me some advice. Give me some advice on quitting smoking. Give me some advice on pain management. When you are shopping at the pharmacy, you can use do you have? Do you have something for a headache? You can use can I have? Can I have a box of aspirin, please? Or I'd like some children's painkillers, please. Or I'm looking for shampoo. When asking for things, you can use can I, could I. Can I have a look at that, please? Could I get one of those, please? Or if you want to be really polite, you can say, is it possible? Is it possible to see the doctor this morning? Is it possible to discuss this with the surgeon? Is it possible to get a different brand of medicine? Or if you want somebody to do something for you, and you want to ask politely, very politely, you can say, would you mind? Would you mind closing the window? Would you mind dropping that in the bin? Would you mind getting me a glass of water? Notice that all the words after would you mind end in ing. Getting, dropping, closing. You can use could you or can you. Can you give me something for that, please? Could you take me to the hospital? Can you send someone to get her, please? Could you check my dressing? A dressing is something which a nurse uses to cover a wound. To politely say what you would like to do, you can use I'd like to. I'd like to go home now. I'd like to make an appointment. I'd like to talk to the surgeon. You can use I'd rather or I prefer to politely reject an offer. I'd rather wait for a little bit longer. I'd rather have a private room. I'd rather see the doctor today if I can. I prefer to use the toilet. I prefer to see a female doctor. I prefer a female nurse. When it's important, you use the word need. I need a doctor. He needs an ambulance. We need to stop the bleeding. I need something for this headache. She needs to sit down. If it is not important, simply a suggestion, you can use we could or should we. We could see a doctor. We could see a doctor if you like. We could put a band-aid on that. We should take you to hospital. You should sit down. Should we go and get that looked at? Looked at here means looked at by a doctor. Should we go now? We could stop by the pharmacist. We could see if a doctor's available. Another way is why don't we? Why don't we get that looked at? Why don't you sit down? Why don't I get you a cup of coffee? Why don't you ask the doctor? Or why not? As a suggestion. Why not try some painkillers? Why not give it a go? Why not try the patches? Another way is using how about. How about getting into exercise? How about walking to work? How about we just wait and see? When dealing with matters of health, you may find that you need to encourage someone. You can't simply say the same words over and over again, so here are a few phrases that you might be able to use. But first, some helpful vocabulary. To reassure is to make someone feel better about a situation. You can reassure somebody with a phrase such as, "You'll be fine," or "You'll be just fine," or "You'll be alright." To encourage somebody who is making a good effort, you can say that you're coming along well, or you're doing well, you're doing really well. If somebody doesn't want to make an effort, you can say, "Come on, give it a go," or "Have a go." Come on, have a go. To tell somebody to stop thinking about how difficult something is, you can say, "Oh, come on. Oh, come on, you can do this. Oh, come on, you've done something like this before. Oh, come on, you have to try. Oh, come on, it won't be as bad as all that. It won't be as bad as all that." That's a saying you can use after somebody's described how difficult something's going to be, especially if they're just trying to talk themselves out of it. To talk yourself out of something is to convince yourself that you shouldn't even try. Another saying is, "What have you got to lose?" Or another way of saying that is, "There's no harm in trying." As well as "you'll be fine," you can say, "It'll be fine." It'll be fine. Be careful giving reassurances, because using the wrong one at the wrong time can make you seem insensitive. If somebody says, "I have cancer," don't say "it'll be fine." To encourage somebody to rest or relax, you can say, "Take it easy. Take it easy, I'll do the dishes for you. Take it easy or you'll hurt yourself again. Take it easy, you're still sick." This concludes our session on health and well-being. Thank you for joining us at Edupedia World, and I hope to see you again soon.